I'm Jenna. I'm a licensed clinical social worker at the Autism Society of North Carolina. And you'll also see after my name, NADD-DDS. So I'm also a certified dual diagnosis specialist through a global organization called NADD. Their mission is to share knowledge, training, policy, and advocacy, as well as promote a high quality life for people that have IDD and mental illness. So this topic today, I'm pretty excited and passionate about it. In the 15 years I've been in North Carolina, I've worked for 2 different LME MCOs. And I'm sure you've heard that term before, but we're going to define it and clarify it a little bit for you. I wanted to start by sharing several terms, or I might call them buzzwords, that are used to refer to the wait list. So some of them are the innovations wait list. We might say that someone is on the run, which is kind of a funny way to say it. We might call it the waiver wait list. Sometimes we say it's the IDD eligibility process. And the more formal term for it is the Registry of Unmet Needs. We abbreviate that as the RUN. These terms can all mean the exact same thing. The RUN is important for many reasons, but the biggest ones in my experience are that this process is the main way to get an innovations waiver slot in the state of North Carolina. If you aren't on this wait list, then you have little chance of accessing the innovations waiver. As part of becoming eligible for that wait list or the RUN, you're also found eligible for IDD services. So these are services that you can receive while you wait for an innovations waiver slot. I'm going to talk a bit more about those services later. Third, being on the RUN, it ensures that the LME MCO is aware of you, your diagnoses, and your needs. All of that information is data that the LME MCOs and the state leadership can use whenever they're trying to determine how much need is out there. Does it match the capacity we have? How do we use our funding? What types of new programs do we perhaps need in our state? The last data I could find shares that there's about 12,500 people in the state that receive innovations right now. There are 15,000 who are waiting for innovations. So their names are currently on the RUN. There's an estimated 10,000 additional people who could be eligible, but they're not on the RUN. And that can be for a variety of reasons. Sometimes people don't even know that the RUN or innovations exists. And so that's something that we're trying to work against. Sometimes people don't think it's for them. And so I'm going to talk about that a little bit later too. And sometimes people try to get on it and they don't have the right paperwork. So we'll talk about that today as well. All of this comes together to create this average wait time across the state for the innovations waiver of about 9.5 years. In some areas, the wait is longer. I'm going to use the term LME MCO many times today. It stands for Local Management Entity / Managed Care Organization, which is a lot to say. So it's shortened to LME MCO. These are companies that are in charge of managing the funding and the services for people with diagnoses like intellectual and developmental disabilities, mental health needs, and substance use needs. Even if you have private insurance, if you have an IDD, the LME MCOs are a company you should know about, especially for the RUN. Each LME MCO in North Carolina is responsible for managing the RUN or the Registry of Unmet Needs for the counties that they manage. So this color-coded map, we're going to make sure that you have a link so that you can find which LME MCO manages your county. But it's very important that you have this information because it's a really important piece of this process. As you can see on this map, there are 6 LME MCOs in North Carolina, and they are Alliance, East Point, Partners, Sandhills, Trillium, and Via. I think it's interesting and important to know how the RUN is managed across the state. So I tried to find a more simple way to explain it. The innovations waiver is slot based. So if you think of slots like chairs at a table, the goal is to fill all of the chairs and then have a wait list for people who don't have a chair. If someone leaves their chair and remains out of that chair for a specific period of time, then the LME MCOs will refill that chair or that slot with someone new from the wait list. If new chairs are pulled up to the table, people get to come off the wait list. The reasons why someone might leave their chair or their slot includes that they might choose to give up the program. If they pass away, they have to leave the program. If they enter what's called an institution for a long period of time, so a hospital, if they go to jail, if they're in an ICF facility, and if they move out of the state, they need to leave their slot. There is variation between those 6 LME MCOs across the state, and it can make all of this confusing in another way. So before we jump all the way into the nuts and bolts of what you need to get on the run, I wanted to debunk a couple myths. First, you do not need to have Medicaid to apply and to be on the wait list. And I'm going to repeat that. You do not need to have Medicaid to be placed on the wait list. You also do not need to be found disabled through the Social Security process. You do not need to receive disability funding every month to go on this wait list. You can live independently and have some, of those higher level independent skills like driving. You can have a job and you can still qualify to be on the waiver wait list. It is not only for individuals who have very significant disabling conditions. And the last one, there's no age limit for the run. When I was working at one of the LME MCOs, we talked with a pregnant woman whose child was given a diagnosis based on some medical tests of Down syndrome while she was pregnant. In her situation, she was able to call just a few days after the birth of the child with that confirmation of diagnosis, and that child was able to be added at a very, very young age. So despite the LME MCO processes having some variation, I did find that there are some basic pieces of information that you need regardless of which county that you live in. So first and foremost, the biggest piece of information you need is really in documentation. We typically see psychological evaluations and we see some medical documents. Those documents need to contain items on this list. So first, it needs to clearly spell out a qualifying IDD diagnosis. And I'm going to talk to you about some examples of how it can be clearly listed. And I'm going to talk about the reason why we need to know it began before the age of 22. We also need in those documents either psychological or medical assessment. So we need to know maybe measures and tools that they use to arrive at that diagnosis. And the last piece that your documents need to have is an adaptive function assessment. So I'm going to explain to you what that is, because I think that that's a little confusing and why it's important. Very frequently, IDDs are diagnosed through a psychological evaluation. And a psychological evaluation is actually a process as well as a document. The process and the document, it gathers developmental, medical, behavioral, and psychiatric history. Within the document and within the process, they use different tests and questionnaires and assessment tools. There's note of what they observed and notes about how they interacted with the individual. And all of that is done to assess an individual's behavior and their needs, because the whole goal of the process and the document is to determine what's going on. What is the diagnosis? The last really helpful thing that a psychological evaluation does is that it provides recommendations. So what should we do next now that we have all of this information? A qualifying IDD diagnosis is, it can be a lot of things. So IDD is one of those diagnoses that's an umbrella. We talk about what's up top. This is IDD. There's a whole lot that fits underneath it. So on your screen, I listed a number of diagnoses that do fall under the IDD umbrella. But again, it's really a broad term. It's not a specific diagnosis. So there's a lot of conditions that can qualify. Some are pretty common and some of them are very rare. So why does that diagnosis need to be present prior to age 22? And this part can get sticky. So the answer is first that the innovations waiver by design serves people with primary diagnoses of IDD. By definition, IDDs begin during development, and that is defined as below age 22. Some individuals, I think this is a hard and confusing part because they may not have documentation from their childhood to confirm that diagnosis. Maybe they did have it, but those documents got lost or destroyed. And I've certainly worked with a number of people who didn't have help and support until they were adults. And then they started to have these questions about, things that were hard for them and in ways that maybe they're different from some of their peers. And all of this, it doesn't mean that you can't qualify. I think that it's okay because that is what it is. That's the reality. What you do need to have is whenever you are seeking a diagnosis is to talk with that psychologist or provider and help them kind of be a detective in that way to figure out, do we have any proof or can we talk to somebody? Is there an early reporter? Is there someone that knew you well when you were a child that can help that person providing the diagnosis really determine, do I think this started during their developmental years? The way we've seen it show up in documentation is that the psychologist or the specialist who's providing the diagnosis will provide what we call an attestation. So they'll just say, it is my clinical opinion that this diagnosis began prior to the age of 22. And so the last piece of that, of number one, the qualifying IDD diagnosis, is that it needs to be clearly listed. This is an example of how a diagnosis can be clearly listed and confirmed. It shares it says diagnosis. It shares the exact diagnoses that resulted from this evaluation. On the flip side, at the bottom of your screen is an example of a really beautiful psychoeducational assessment. So it's a school assessment for school purposes. And the language in it, it does share that specific evaluation tools were used, right? The CARS for autism was used. I highlighted, it says their score falled in the severe symptom category. This evaluation on the bottom very often doesn't work to get on the innovations waitlist simply because it doesn't clearly state, I am diagnosing them with this condition. And I think that this is one piece that I would love for you to all take away, is that when the only evaluation is through the school, read it carefully. If it doesn't explicitly and clearly say this is the diagnosis, it may not be what is needed to get through the process. So next we want to talk about number two, the psychological/medical assessment that measures that confirm the diagnosis. Generally, the type of evaluation or measures needed to confirm a diagnosis should match the general type of developmental disability it is. I think this piece is also confusing. It can create some frustration for people and families out there. Generally, if there is a medical or genetic cause to the IDD, the LME-MCOs will want medical or genetic documents to confirm that. If the IDD is related to delays or disabilities in something like fine motor or gross motor, the LME-MCO will want documents from specialists like physical therapists, or they want an evaluation that tests your fine and gross motor abilities. The aim here is really to make sure that the person providing the diagnosis is actually a specialist for that kind of disorder and has the authority to diagnose it. The last one that is generally required is adaptive function. This is the one, in my experience, that I have seen is often absent from those psychological evaluations and documents. So LME-MCOs require adaptive function assessments within those evaluations. So on your screen in the black lettering, those are 4 examples of adaptive function assessments. I do encourage families that are going and seeking testing to make sure that you say this is required and to even suggest some of the assessment measures on your screen. I have found psychologists tend to like certain measures over others. It's really kind of an individual decision. The psychologists I've worked with, I've never encountered one that's like, I don't know what that is. So hopefully that's your experience too. But the whole importance of adaptive functioning is because many diagnoses impact how you can take care of your own needs and how you show up as a member of your community. So those adaptive function assessments, what they do is they help measure with numbers how easy or difficult it is for you to do certain daily activities and be a member of your social community. So in other words, what it does is it helps figure out how your diagnosis, like how significantly it impacts you on a day-to-day basis. Adaptive function is measured in 2 ways. So you, if you've got those skills and abilities, can report to the person doing the diagnosis how easy or difficult it is for you to do certain activities. You can also have someone who knows you well. They can complete questionnaires and they can also share verbally how easy or difficult they've observed certain things being for you. Some examples of the areas that are measured in adaptive functioning, there's, I think, 6 categories, but it might ask questions like, can you say the month and day of your birthday when you're asked? Can you mix and prepare food? Can you cook with kitchen appliances? Can you travel independently to an unfamiliar place? Can you fill out a job application? And again, those are just trying to tie your diagnosis and how significantly it's impacting you. So let's imagine that you have all of the correct information in your documents. You go through the specific LME-MCO process and you're now on the waiting list. What do you do? I put a storm cloud there because this is the part of the process that I think can be the most discouraging for some people. You go through all of this work to get on the wait list, and it can feel like in some ways you've achieved a lot, but you're still not getting the type of support in the intensity that you need. I always, always, always recommend that one of the first questions you ask is what services, what IDD services are available while I wait? So while you're waiting for innovations, the answer again is it depends. Every LME-MCO, their funding can be used in different ways. They may have different programs and services than the other ones. It's going to be pretty individualized to your LME-MCO and even down to the county that you live in. But the services generally can include something called community living and support. That's a skill building service where a trained staff person could work with you or the person in your family to teach new skills. And generally, I didn't put headers here, but the ones on the left are Medicaid funded. The ones on the right are generally state funded. Respite is available at a certain intensity. And that's really just someone coming in to monitor health and safety and make sure that everything's going well. Community guide is more of a kind of resource referral, can be an advocacy support and supported employment. On the other side, developmental therapy is more of that skill building support. Developmental therapy professional is someone who can come in and provide a little behavioral recommendations. There's respite. I think it's quite limited, but sometimes there's behavior support planning funding, and personal assistance is someone coming in and helping with personal care needs. So what else should you do while you're waiting? in my opinion, I think it's really important that you call at least once a year to verify that you're still on that wait list. I can't speak to how sophisticated or not all of the systems are for keeping track of the wait lists, but I think keep your documentation, make sure you're calling once a year. I also think that annual call is a really great time for you to update the LME MCO on what your needs are. If your needs have increased, call them and let them know that. It's important because LME MCOs, they don't know what your needs are unless you tell them. They also may have flexible funding or programs that could benefit you that you don't know about. LME MCOs, they also periodically get what's called an emergency innovations waiver slot. The number of them is very small, but you can't request one or be considered one unless the LME MCO knows about you and knows what you need. And the other thing that I think is really important to know is when you call the LME MCO, they type your phone number and your name in, but they also connect it to whoever the client is. And they're documenting what you're talking about, what you're asking for, what your needs are. So if ever you're being looked at for an emergency innovations waiver slot, they can access all of those notes over all of that time. One of the big things that I've found in the work that I do is that sometimes it's creating a body of evidence, right? I think that a lot of the people I work with, they kind of suffer in silence through some of these things because, I mean, I get it. The help doesn't feel like it's always there. I think this is one way to really make sure you're creating a body of evidence and you're putting your information out there to the people who get to make some of these decisions. So my agency, we have people who have loved ones that have autism, and they are autism resource specialists. You can request someone from that team to help you. And one thing, specific to the Registry of Unmet Needs, we can help answer questions. We can look at your documents and tell you if we think that it has the right stuff in it. We could even help you call the MCO. I think it's a fantastic resource that I think everybody needs to know about. So if you've got autism, suspected autism, anything like that in your family or orbit, please reach out. For those with other IDDs, I strongly recommend connecting with the ARC of North Carolina. That agency is filled with incredibly knowledgeable and strong advocates who know and understand the system and how to navigate it. I always include crisis resources. This is a really great website to know what the crisis resources are within your specific county. It was kind of news to me, but mobile crisis is available even if you've got private insurance. I know it's not always the best fit, but if anyone's been to the emergency department recently, I think that most of the time I'd prefer mobile crisis over that experience. DHHS has helped create this resource, the NC Complex Needs resource, and I think it's worth a visit. There is a Children with Complex Needs settlement at the state level. Rachel Johnson and her phone number is listed there. If you've got a child under age 21 who has IDD and a mental health diagnosis, definitely reach out and see what's available and what they could do to help. I always plug NC Start. There's a wait list. So if you feel like this program could benefit you, definitely give them a call, learn a little bit more about it, get on that wait list. And tailored care management, if you have Medicaid, I would encourage you to call the LME MCO, see if you qualify for tailored care management. And if you do, find out who you're assigned to, because this is someone who's paid to help you. And I know that a lot of people could definitely use more help.